Hi, my name's Kristen Slagle, and I'm here today to talk with you about what it is that I do best. I have worked for about 30 years as a registered polysomnographic technologist. That's a really fancy way of saying registered sleep tech. What I do currently in my job is I analyze sleep studies and I prepare a report for the doctors so that they can interpret and diagnose and treat patients for different types of sleep disorders. During a sleep study, a patient comes in at night and we prepare them for the study by putting monitors on them, little sticky patches or wires that attach to their scalp and chest and legs. We're looking for a lot of different things, their brainwave activity and breathing patterns, heart rate, EKG, leg movements, lots of different things. Problems during the night in with different body functions can cause somebody to be really sleepy during the day or have other symptoms, and so it's important to have a sleep study and then have it properly analyzed so the doctor can know what to do. I'm going to show you some things, examples of sleep studies. This is what I look at during the day. I go through the sleep studies and review them for the sleep stages and other abnormal activity, and I tabulate that for the doctor. This is an example of stage 2 sleep. There's not much eye movement here. That's what these two lines are. But there are sleep spindles and K complexes. It's very normal. That's what most of our sleep looks like for most of the night. So if I were to run a sleep study on you, this is very much what your brain activity would look like. This is an example of dream sleep. This is REM sleep, or rapid eye movement sleep. And the EEG is a little bit different, but what's really different are the eye movements, and you can see all the activity in those two channels now. What's happening is the patient's eyes are going back and forth like windshield wipers, and that's the movement that we're picking up. This patient has severe obstructive sleep apnea. He's trying to breathe. You can see the movement, but the flow lines are flat, which means his breathing is obstructed. And he's snorting or snoring and waking himself up. You can see the movement or the change in his EEG activity. And his oxygen saturations are dropping dramatically. What happens, though, is he wakes up a little bit, or his brain wakes up, I should say. He might not even remember this, and then he has another event, and the same thing just happens over and over again. On this 2-minute window, you can see there's 4 episodes right there alone. And if somebody has this hundreds of times a night over and over again, year after year, you can see how that could be really damaging to the body. This is just one page of the report that I process. It's a histogram. This is the beginning of the night, and this is the end. And you can see where the patient had a lot of severe events right here, but as we opened up his airway with an air treatment, it got better over the course of the night. It's not perfect, but it's a lot better. And that's what's rewarding about my job. It's interesting. I get to help people sleep better. I get to help the physicians help their patients. And it's a great job. I really like it. And I'm good at it. Thanks for watching.